How is a diverticulitis fistula managed conservatively? Have you ever wondered how a diverticulitis fistula is managed without immediate surgery? A diverticulitis fistula is an abnormal connection that forms between the colon and another organ, or even the skin, due to complications from diverticulitis. When this occurs, conservative management can be an effective approach, particularly when the output from the fistula is low and the patient is stable without severe infection or sepsis. The first step in conservative management often involves controlling infection and inflammation. This is typically achieved through broad-spectrum antibiotic therapy, which may be administered for several weeks. During acute phases, if the fistula involves the bladder, placing an indwelling urinary catheter can help reduce symptoms and promote healing. Supportive care is also essential. This includes optimizing the patient's nutritional status and addressing any anemia, which can improve overall health and enhance the immune response. If an abscess is present, percutaneous drainage may be performed to control sepsis and reduce inflammation. To accurately diagnose the type of fistula and monitor healing progress, imaging studies such as computed tomography scans, cystoscopy, or magnetic resonance imaging are important. In some cases, innovative treatments like vacuum-assisted closure therapy and the endoscopic application of organic glues have been used to aid in the closure of the fistula without resorting to surgery. The goal of conservative treatment is to control infection and inflammation, potentially allowing for spontaneous healing of the fistula or delaying surgery until a safer, elective setting can be arranged. Surgery is generally considered only when conservative measures fail, if the fistula causes significant symptoms, or if complications arise. It is crucial to understand that conservative management requires careful selection of patients and close monitoring by healthcare professionals. Diverticulitis fistulas can have a complex course, with risks of recurrence and complications. Therefore, personalized medical advice from specialists is essential to determine the best approach for each individual. In summary, managing a diverticulitis fistula conservatively involves prolonged antibiotic therapy, drainage of any abscesses, supportive care, and sometimes additional therapies like vacuum-assisted closure or endoscopic glue. Surgery is typically deferred until the conditions are optimal or if conservative treatment does not yield results. Always consult with healthcare professionals for tailored advice and treatment options.